Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we'll be seeing about the topic is PICA. So PICA is very common in children's population. Why? Because they'll be intaking any non-nutritive substances, maybe due to the over curiosity or exploratory behavior or due to some deficiency of the nutrients. But in many of the PICA, that is in different types of PICA, the only reason for this is maybe that children will be lacking of any nutritive values, that is either deficiency of vitamins, minerals or ions, calciums, like that. So have you ever wondered during the rainy season also we all think that the smell of the mud makes us to take the mud and eat. In the same way, the children who have any deficiency in their body, they will have the urge to eat that non-nutritive substances. They cannot control themselves by intaking this non-nutritive substances. So we will see one by one in detail what does it mean by PICA. So introduction. PICA is a eating disorder. It is an abnormal and very misunderstood problem. The word pica comes from the Latin word magpie, which is a bird that will eat anything on whatever it finds or comes across. This means that the pica is a eating disorder, and it means any person who just sees that particular substance or any materials, they will urge to intake that particular food item. So maybe that is like chalk pieces, even some eats feces or the hair, mud and cornstarch powders, and even sometimes some will be eating the rice, raw rice. So these all are the some of the examples of pica. That means it does not contain any nutritive value, but due to the urge to eat that, and they have that habit of intaking that food at least for 1 month, then only we can diagnose that particular person as having pica. So some will be intaking the ice cubes from the fridge. So children usually do that, but if they have those pica symptoms, means they will be intaking that ice cubes again. Very often they will intake it, and we have to see that any children who is intaking any non-nutritive substances, if they are taking for 1 month, so till 1 month if you are taking, if they are intaking those food item, that is non-nutritive food, means it is considered as pica. So definition. It is defined as a persistent, compulsive, bizarre craving, that is abnormal appetite of mouthing or eating of. First one is non-food. So any substance which is not considered as, not at all considered as a food material, they will intake. For example, clay, dirt, sand, stones, pebbles, hair, feces, lead, vinyl gloves, plastic, pencil, erasers, chalk, wood, light bulbs, needles, string, cigarette butts, wire, burnt matches and ashes, and even fingernails, and like waxes, plasters, wood, chips, paint chips. So they will be going and licking their the wall paintings, like that. So any children those have a bizarre craving, they cannot control themselves from intaking those non-nutritive substance, that is even a non-food, they will be intaking that particular materials. So I have mentioned in this examples, no, these all is not at all considered as a food, but they will intake this materials, these products, and they will think, and they even know it is not at all a nutrient one, it is no more going to help their in growth and development, but due to their out of curiosity, out of the compulsion among themselves, they will eat those non-food substance. Next is non-nutritive item. So these examples are the food items, but it does not contain any nutritive value like proteins, fats, carbohydrates, like that. So first is like raw potato, starch, cornstarch, laundry starch, dry milk of magnesia, paraffin, coffee grounds or ice for a period of at least 1 month. So any person who is taking either non-food or non-nutritive substances for continuously for about 1 month, that persons will considered as having a symptoms of pica. Then we have to do the various diagnosis and then we have to identify what pica they are having. So DSM criteria. According to the DSM criteria, to be diagnosed with pica, a person must display persistent eating of non-nutritive substances for a period of at least 1 month. The eating of non-nutritive substance is inappropriate to the development level of the individual. The eating behavior is not a part of culturally supported or socially normative practice. So we know, right, if a group of people is doing some activity, only one is being deviated from that group means we'll come to know, okay, that particular child is not normal. In the same way, these all activities, the children who are intaking these all non-nutritive substance has to be taken a special attention. Then we have to correct it appropriately. Next is types of pica. So geophagia, that is clay or dirt eating. The clay or dirt tastes or smells good for that children who quells the craving or helps to relieve nausea or an upset stomach. Next is pagophagia, that means the child who intake the ice cubes. So these children, mostly out of 10, the 9 will be having any nutrient deficiency. Next is ice eating usually stops completely when the iron deficiency is being treated. When we treat those underlying causes, then automatically these pica will be either reduced or prevented, or it can be like eradicated. So first is geophagia, next is pagophagia. Geophagia in simple term, that means intake of clay or dirt particles. Pagophagia means intake of any ice cubes or ice. So this all activities will be carried out till the 1 month of age. So if they are taking 1 to 2 days means you cannot diagnose them as a symptoms of pica. So that children's we have to do the follow up and regularly we have to watch it. Then only we can diagnose it whether the child is having any kind of pica or not. So next is amylophagia. That means laundry starch or cornstarch eating. So that starch will be like sweet in taste and crunchy texture of flaked laundry starch are attractive to a small number of women, especially during the pregnancy period. So the taste of such starch almost always disappears after the pregnancy, and their infant are more likely to be born in poor health. So anyone, the pregnant women, they also have this pica. So eating the non-nutritive substances, they have some signs and symptoms related to pregnancy. So when a baby is born for a mother who is taking these kind of non-nutritive substances, that child will face a nutrition deficiency in their future times. Next is plumbism, that is lead, primarily from old paint flakes eating. So you would have seen, no, like babies will be going and licking the walls. So just licking that paints. So that contains a lead material that may sometimes causes death of a children. But that means if they are taking in more amount, or sometimes causes a mental retardations and even death in young children. So low levels exposure that leads to hearing problems, growth retardation, reduced intelligence and poor classroom performances. So the regular consumption of lead based paint chips from the old houses is a major cause of lead poisoning in the young children. So many children, what they do is they don't go and lick the walls, and if they are being doing this again, what happens, it will be intaken more amount that causes the death, even the death in the children. Next is causes. So psychological causes is mental illness or psychological trauma can trigger pica in some people. So pica is often a hallmark of extreme stress, fear or abuse. So factors such as emotional deprivation, poverty, poor nutrition, anemia, neglect, lack of parental supervision or developmental delay increase the risk of a person developing this eating disorder. So next is associated with the pregnancy. So pica commonly occurs in a pregnant woman who are experiencing their first pregnancy and have a history of pica in their family under the age of 20 and had suffered from pica as a child. So even when the during their childhood period, if they had any symptoms of pica, that will be being highlighted during their pregnancy period. So that is also associated with the pregnancy times. They will be taking any cornstarch or something that causes the symptoms of pica. Next is associated with the child itself. So predisposing factors like parental neglect, poor supervision, mental retardation, lack of affection of psychological neglect, family disorganization, autism, and lower socioeconomic classes. So far we have seen the associated symptoms related to the psychological disturbances and the pregnancy associated symptoms. Now we are seeing about the associated with the child itself. So child, if they having any lack of like these kind of predisposing factors, they are prone to get the pica symptoms. Next is dangers of eating pica, that is non-nutritive substances. It causes iron deficiency anemia, lead poisoning, exposure to the infectious, life-threatening toxicities, gastrointestinal tract complications including mechanical bowel problems, constipation, ulceration, perforation, and intestinal obstruction have resulted from pica. So these all are the dangers of eating the pica. So when they are continuously having the urge to eat these non-nutritive substances, they may end up with these kind of complications. Next is treatment. So psychosocial, environmental, and family guidance approaches. That means you have to socialize the children. So when they have any stress or depression or frustration, the child will automatically will just adapt for any defense mechanism. So they use eating of these non-nutritive substance as their own defense mechanism. So we have to just treat the underlying causes. Next is behavioral therapy. Like you have to discriminate between what are the edible things, what are the non-edible things, like that. Next is self-protection devices that prohibit the placement of objects in the mouth. So it is quite difficult for us to just tie up their mouth or something. That is not at all advisable. But you have to provide a behavioral therapy, like you can discriminate. So these all are the edible things. This is only going to give you the nutrients to the body. This will only help you in the growth and development. And sometimes what we can do is like we can just change the texture, smell, or the taste of that particular product, so that the child will not touch that food or the non-nutritive substances or non-food substances. And also we can give them training, like how to control by not to eat those non-nutritive substances like hair, feces, or chalk powders, rices, like that. Next is brief physical restraint can be done. If it is very extreme cases, you have to do the physical restraint. And overcorrection, that is correct the environment or practice appropriate or alternate response. That means you have to prevent the reach of that particular food items or non-nutritive substances in reach of children. So if it is in the eyesight of the child will go and eat it. So you have to make sure that it is not visible to the child. Next is sensory reinforcement involving screening, that is covering of eyes, contingent adversive oral taste. Like you have to change the taste of that particular items, means that is non-nutritive substance, means they will not like it. So what happens, they will reject those items, like smell sensation, like ammonia if you are being using it, and others like physical sensation like mist or water if you are being spraying on it, so that the taste and texture will be differing. Next is conventional medical treatment may be appropriate in certain situations. That is, for example, supplementation with iron containing vitamins, and has been shown to cause the usual cravings to subside in some iron deficient patient. So some of the reasons for the pica, the underlying cause is iron deficiency. So if we are being treating those iron deficiency, automatically the symptoms related to eating of non-nutritive substances can be subsided. So how we can prevent is, there is no any particular method to prevent it, but the only thing we can do is we can keep those articles out of reach of children. Next, close observation of children each and every time. So pica just comes to and go to some people, that is need to pay more close attention. So it is not a serious problem until unless the child becomes very much addicted to the eating of those non-nutritive substances. So we have to make sure that the child does not become addicted to that eating of non-nutritive substances. So far we have discussed about what is meant by PICA. What are the causes of PICA, that is associated with the psychological symptoms, pregnancy associated symptoms, and the associated symptoms of child itself, and what are the types of PICA, like pagophagia, next amylophagia, then what are the ways to treat this PICA and how we can prevent it, like by providing the reinforcement therapy, like behavioral therapy, and making the children not to have a visual contact of this particular product, like that. So this is about a simple term, PICA. If you have any doubt, kindly drop down in the comment box, and kindly like it, share it and subscribe it. Thank you for watching.